Good afternoon, everyone. Welcome to the final session of Mental Wellness Week, and I want to thank you for being here today and for being a part of this all week. Today we've got the privilege of hearing from the physician's perspective, and we will hear from Dr. Daniel Palais, and his wife, Dr. Chantal Pillay, is joining him today as well, and so it's nice to have both of them. They are they have moved to Sussex just within the last 2 years from South Africa, and they've relocated here to establish their medical practice. And so it's great to have you with us today. Thanks for joining us.
Hi guys. We were just telling Kirk, it's been so long since we were in university, we feel like dinosaurs now. Try not to think about it. Shove it down, way down. Don't show it. It's bubbling up. It wants to escape. I don't know how long I can hold it. I'm not that strong. I want control over it, but it consumes me. I am it, and it is me. I wasn't always this way with it. I never would shove it down. Until one day I was mocked for showing it. I was told I was weak because everyone has it and they can control it. It's all in your head. You're a crybaby. I believed it. Why wouldn't I control it? Why couldn't I control it? Next time I'll try my best. But I feel it again. It's about to escape. I can't let in. I try shoving it down, way down, but that doesn't stop it. Now it's flowing out of me like water. I need to stop it. I run to my room, lock the door, shut off my phone so no one can see it. I look in the mirror, puffy face and bloodshot eyes are the result of it. I sit in front of my fan, the cool air dries it. I sit until all the evidence is gone, until I can walk out of my room and deny it. I have to. I'm not a crybaby. I can do this. I am it, and it is me. When I was approached by Reverend Lee to talk about mental health, I jumped at the opportunity. This is something I see so much of in my daily life, and young people are probably the most missed or underdiagnosed group that there is. Oh, I had great plans. There was going to be ominous, awe-inspiring music, scenes playing in the background of a jogger waking up at dawn, of somebody falling down and then getting up again. Maybe the voice of Morgan Freeman giving random words of wisdom in melodramatic tones. But then I realized that life is not a motivational YouTube video. A few choice words with inspirational music and a scene from The Pursuit of Happiness is not what's needed here. Maybe what's needed is not motivation, but rather an explanation. Mental health issues are getting more attention now than ever before. We have awareness weeks, rallies, talk shows, and a litany of self-help literature and videos. We have prominent people coming forward and revealing their own struggles with mental health. But sadly, we seem to be losing the battle. Every 40 seconds, somewhere in the world, someone dies by their own hand. Suicide is the second leading cause of death in people aged 15 to 24. There is not a single day that goes by in my line of work that I do not see someone affected by mental health issues. It is an issue that is close to my heart and one that deserves all of our attention because it is ending lives, destroying families and relationships, and creating a society that is ultimately self-destructing. Today, I want to concentrate on anxiety and depression, and I want to present it in a slightly different way. I want to share the internal workings of my mind as a physician and show you how we come to a diagnosis, what medications we use, and how we monitor therapy. I want to address some of the myths, and I also want to be honest about some of the shortcomings that we have in terms of both diagnosis and therapy. Before we start this journey, however, we're going to need some perspective. So we're going to do a little poll. Hands up, everyone who's ever used Tylenol before. That's a lot of hands, eh? Discovered all the way back in 1877, it is still one of the most widely used painkillers the world over. It is safe for use in children, and if you've ever been pregnant, you know that it's one of the only things that you can use for pain relief. But Tylenol has a secret you may not be aware about. We have no clue how it works. We have an idea, but we are not exactly sure as to how it relieves pain. If you don't believe me, Google it. We can talk afterwards. My point here is that while we may not understand everything, we know enough to say, here, give this to your baby and your pregnant wife, and we have the evidence to show that it is indeed safe and effective. When it comes to depression, a similar tale emerges. We have a pretty good idea that low levels of serotonin cause depression, and our therapies are aimed at increasing the circulating levels of serotonin in our brains. That leaves us feeling better. Anxiety works in a similar way. Again, we have the data to show that while we may not know exactly how these things work together, we know that they do work. So, how do we come to a diagnosis? Sadly, there is no diagnostic test that I could send you for and tell you without a shadow of a doubt that you are anxious, depressed, or both. Our diagnosis is derived solely from what you tell us. So this means that the quality of information that you give us is vital. I may see you very often in my office, but that doesn't mean I know anything about you as a person or how you relate in the outside world. Maybe you actively avoid thinking about the way you feel or keep yourself so busy so that you are occupied with something else so that you don't have to think about yourself. Whatever the case may be, this is a huge stumbling block that I encounter often. I don't know is the answer I get a lot of the time when asking pointed questions about state of mind. When your answers are the only tool we have, I don't know just doesn't cut it. Look, I know it's hard. Suddenly thinking about all of the stuff can make you feel worse. 3 people can all have the same issues, and yet 2 out of the 3 can function at an appropriate level despite these challenges. So, how do you know if your depression and anxiety is pathological and not just run-of-the-mill exam stress? The first thing I would do is go to trusted websites such as the Mayo Clinic, UpToDate, or WebMD and research symptoms. I would see if any of those symptoms pertained to me. If unsure, go to someone close to you and ask them if they have seen you displaying any of these features. If yes, the next step is to ask yourself these 2 simple questions. Are these symptoms affecting the quality of my life? And are these symptoms affecting my activities of daily living? If yes, then it likely means that your symptoms need attention. If you realize the signs early enough, counseling may be the only treatment you need. However, most of the time it's too late for counseling alone, and you may have to consider medication. Unfortunately, the gray zone follows us into this phase as well. You could have identical twins and put them on the same treatment, and their experiences with those medications would be completely different. Going by your symptoms, your doctor or nurse practitioner would be able to narrow down the list and choose the right type of medication. Now, here's another issue that's not made mention of enough. In the first few weeks of taking an antidepressant, it can actually make you feel worse. Again, the reason is not completely understood. It's important, therefore, especially in the first few weeks, that you have someone looking after you and making sure that you're okay. It takes time to work, roughly 6 to 8 weeks, and its function is to make this into this. Now, the medication is not a miracle drug. There are things that are going to happen in your life that make you feel really down, but this is normal. This is life, and this is also what is part of what makes us human. After the initial 6 to 8 weeks, your provider will sit down with you to see how you're doing. You might feel that the meds are working fine, or that they may need to be increased. You might even feel that they are trying to kill you with all of the side effects that you experienced. Again, what you say holds great value, and so it needs to be accurate and honest. There may be a slight back and forth of adjusting and changing meds, but hopefully you get the right fit at the end. Once you have come to a period of control of your symptoms, this is when you can start to try to iron out the causes and try to work on them. When you start feeling better, you will probably think about coming off your meds. please never attempt to do this on your own, as it could have disastrous consequences. Rather, talk to your provider and they can take you through it. This leads me to another myth that I really want to dispel, and that is that it's impossible to come off these types of meds. It's all about timing. Imagine, if you had high blood pressure and I put you on medication. The meds controlled your blood pressure, but in the meantime, you did nothing to change your habits and the circumstances around you didn't change. What would happen if you had to suddenly go off your blood pressure medication? Your blood pressure would rise again. The same thing applies to anxiety and depression. You have to be in a good space in order to go off these meds, and I can tell you from clinical experience, it is possible to do. The sobering reality is that if left untreated, these diseases are deadly. Stigma be damned. Your life is worth so much and is meant to be lived at its fullest potential. The truth is, while we don't know everything, we know enough to be able to effect change for the better. And when you know better, you can do better. Thanks for your time, guys.